Welcome to the Hangar Z podcast, brought to you by Vertical Helicasts. In this two-part series, Bryan Smith and I sit down with Dr. Daphne Ryan, or Doc, as she is known as in naval aviation. Dr. Ryan's a board-certified specialist in orthopedic physical therapy and an aviation specialist physical therapist. She has over 2 decades of experience and over 42,000 direct care patient hours. Dr. Ryan spent the last 7 years working directly with aviators to mitigate their spinal pain. Dr. Ryan's used her passion and experience to keep pilots and aircrew in the aircraft. Owner of Smart BacX Labs in Denver, Dr. Ryan's developed treatments for the military, law enforcement, and commercial pilots, including aircrew, to find solutions to help mitigate their neck and back pain. Stand by for a message at the end of the episode if you are or may be in a position requiring spinal surgery. Thank you to our sponsors, Anodyne Electronics Manufacturing, Precision Aviation Group, and CNC Technologies. Cheers.
Welcome to the Hangar Z podcast, brought to you by Vertical Helicasts. The Hangar Z podcast is the first and only podcast dedicated to promoting and exploring the personnel and equipment behind the missions in public safety aviation. Join your host, John Gray, Jeff Ratkovich, and Jack Shanley.
Still southbound, skidding to a stop. Stand by here. Looks like they're getting ready to bail. Heads up, guys, bailing. Okay, the guy, he's running through the house, jumping the fence, threw the shotgun, threw something out. Grabbing the shotgun. Don't go over that fence. Don't go over that fence. Grab the shotgun again. He is armed. Stay there. Hold your position.
4 on the stop. You're in custody.
Good advising code 4 on the stop.
Going back to your, you talked about growing up and being a part of the military, your family being a part of the military, you moved everywhere. Can you talk about the decision to pursue this as a career and how you ended up working with the Navy and what that's looked like?
That's a circuitous journey. My mom was a physical therapist, and I was always interested in biology and physiology, and I wanted to do that. And, did undergrad at University of Colorado at Boulder, go Buffs, and then did my doctorate at Regis University. And then at the same time, I did a master's in between those two at the University of Colorado and Dr. Roger Anoka's lab. And my mentor was Dr. Sandra Hunter Rainwater, and she's now a professor at the University of Marquette, and she's editor-in-chief of the American College of Sports Medicine Journal. And so I've had pretty incredible mentors that have taught me how to look at what's happening and assess the research. And, Sandra, I was on Sandra's team and we got published in the Journal of Neurophysiology, and that got a $2 million NIH grant, So these minds that are coming up with what we need to look at to get to the answer we need have always been an influence in my life. And then I would say my most influential person was Keith Klein, and I ran into him, and he was NIAP trained in Bellingham, Washington, when I took a job as a physical therapist at Peace Health Therapy and Spine Clinic. And Keith is still there today. So anyone up in the Pacific Northwest, if you're looking for someone great, my mentor who taught me my stuff is available to you at Peace Health in Bellingham, physical therapy. And I'll never forget, I walked in and he, like a few weeks into it, there was only 5 of us in the clinic. So it felt like a boutique clinic. We were starting something really nice. And we were above the neurosurgeons and across from neurology. And Keith was just this stoic, kind of Gandalf Yoda mind. He just, with a great sense of humor and these hands of gold. And people would get better in 1 or 2 visits. And he used to work down by the Boeing plant in Everett. And so he saw Boeing shoulders, Boeing necks, machinist necks, pilot necks, test pilot necks, and the backs. And he was trained through a NIAP-like system in Canada. And he came up to me one day and he said, "Why are you putting that person with back pain on the leg press?" And I thought, to strengthen their legs. And he's like, "Yeah, but you're loading the spine. They're going to walk out of here more painful." What? It was this eye-opening. We just hadn't put it together well in the other places that I had worked at as a new grad. This was at I think I was 5 years out at that time. And then I was stretching a hamstring, and he said, "Why are you stretching the hamstring?" And I said, "Well, because that's what you do. You stretch." He goes, "No, you don't. You don't do that to a spine." And now I'm hooked, right? Just a few little quick, nudges in this new and like unprecedented direction for my world. And he said, you need to have a system. You need to have a system that when you evaluate someone, every single test that you choose to do gives you information, even if it's negative. Oh, it's not the disc because it's this. Oh, they're doing fine because they can do that. Oh, nope, that's injured. We got to look at that. And, and just kind of, you have to be able to pull your picture together. And I said, well, yeah, I kind of want that. Where did you get that? And he said, and we don't get that in grad school. I think that's the problem. People think that you come out knowing that stuff. You come out being able to be safe. You come out being able to do some real basic stuff. But this is a higher level of mental gymnastics that we just aren't well versed in. At least I wasn't. I'll speak for myself. And I have not yet met new grads who are. So let's put those two together. We're vulnerable. We're trying to learn. We all need to be mentored. And Keith took me under his wing and he said, you have to go and learn some of these NIAP courses if that's the system you want to do. And I said, yeah. And I was just hooked because my patients got better. They were grateful. I didn't beat my head against a wall. I found answers. I said, oh, that's not working. Let me fix it. And they got better. And it's empowering to be able to do your job well. And then 10 years of over-the-shoulder mentoring in Bellingham. And then we merged clinics and it just changed. The atmosphere changed. Our small family went to this big group and they're all, some of them are still there and it's lovely, but it's different. So I wanted to change. And so I was looking to move. I even looked to join the Army Reserves and the Air Force Reserves. The Air Force weren't hiring. Now they are. They're actually winging some of their physical therapists, but that doesn't mean they get spine background. And so picked up, moved down back to Anacortes on a Thursday. I was like, I'll just come down here for a little bit, see what I find. Maybe I'll go to Australia. And on Monday, one of the pilots from the base that I had met in another random way said, the PT on the base just quit. Do you want the job? And so I quickly snapped that up. I said, yeah, why not? Let's try it. And got through all the credentialing, showed up at the base in March 2017. And then I find out that I'm going to be embedded with the family practice, which means you're not in the PT department. You're part of that medical home practice. And that's the dream, right? To always have direct access for musculoskeletal care. You walk out of the doctor's office and 30 minutes later, you're with the PT and she's looking at your neck and you're back in the plane. That was the model. And they wanted me to be there for dependents and retirees. And then the flight surgeons started hearing from other patients, oh, who's the back doc? What's going on over there? And so then they came and kind of got to know me. And the 138 flight surgeon, BAQ 138, his name was Dr. TJ Algiers. His wife, Rita Chukka, was a physician assistant, and we worked across from each other. So now I know him, and now I get to know the other one, and the other one, and the other one, and the other one. And they start bringing all of their flight line people into me. And now I'm only seeing active duty. And now it's the flight line. And then safety officer and AMSO and CVWP. It's Commander Jeff Pinkerton. He's now the XO of VAQ 135. He was the CVWP safety officer. And then it was Lieutenant Commander J. Taylor Dory Burton. Dory. He was the AMSO, and he in his past life, he was the helicopter pilot.
Okay.
And so they saw what I was doing. And the next step was, we need to get you into the jet. You need to know what we go through, because Dory would say, if we can get it out of your head into what we do, then we'll have really good interventions to treat our neck and back pain. Like, how do we know that what you're giving us is you knowing? So eventually we said, it's put the provider through the pain of the aviator to provide better interventions. And some people are like, oh, you really want to go through that pain? I'm like, I go through pain anyway. I don't want it to be waste. I'd rather have pain that is for growth than pain that's wasted. Pain of regret versus pain of growth. Give me the pain of growth. They just say lightning struck. They just had a good person. It's interesting to have the skill set brought to the line rather than individuals having to go find the skill set in different areas. They taught me the aviation world and I taught them the spine world. And it was just symbiotic and kept going. And that's kind of how we got there. And then they put me up to Air Boss Weitzel as a project specialist. So you can get a VIP clearance, which is 90 days. And then Dory found this 4-year project specialist NATOPS designation that's that you can also ask for. And lo and behold, as far as we know, I'm the only contractor on the medical side that's been given that in the Navy so far. But I also had something valuable to give back. Scott Dorkin, you mentioned him. He had a really nice something to give back, right? And so people wanted to help. And our project for me is the next steps are to, I'm a civilian now, because when you're not a contractor, you don't have that project specialist designation, is to either have that reinstated, because my all-qual to do VIP ride is up in January, or to just leave it as a VIP status, but get to the carriers and try this stuff in the carrier setting for maintainers and pilots to then say, aha, we now have something that we can add to maybe even the Habit app that's coming out for neck and back pain from the Navy. Dory's been instrumental in putting that together through Sinatra. Lieutenant Commander Burton's he's just given his heart and soul to that. And now it'll be accessible around the world versus one gym at one base. It's instructions. It's just a brilliant idea, the keep it simple piece. So I got up in the jet and I did a night vision goggle ride with search and rescue, did some other search and rescue stuff. I was able to do a night gunship ride and, seeing what people, and I'm sitting there with aircrew. So I'm like, man, my back hurts just looking at you guys, and just the forces of the G and how beat up you are and what that does to the spine and just your system, the sweating and I'm tired and just all of it. And, 209 flew me through the Top Gun 2 route, so that was probably a highlight. But I think being a bigger highlight was now I know what they go through. So when I tell them I understand their pain, they know I'm not blowing sunshine and just talking something to sell something. I've probably paid more as a contractor to the Navy. Like I've had to move myself a few times and that kind of thing. And I had to pay my way to teach at NAMI in Pensacola because I was a contractor. And if I didn't pay myself and they paid, it would be breach of contract because they were asking me to do more than what the contract said. But I wanted to make sure they had the information. So I did that for several years, so it's just, I think if anything, we always think, oh, the contractor trying to get more from, get their payday. And it's almost, I've had to pay out, but it's worth it because I get docs, thank you. I feel so much better from people that have hurt 15, 20, 30 years sometimes. And you kept me at, one CO said, you kept me in the jet. And that matters. That's invaluable. That's priceless.
Yeah. And I think that's what everyone wants, right? Is to, one, they want to lengthen their career. And, and two, they want to retire and be as pain-free as possible.
Oh, yeah.
And like Bryan mentioned, that may not be the reality of the situation, but learning how to mitigate and deal with some of that is important, And
it's possible. I think a lot of people think that's, a myth. And I see it every day where people, one guy goes, oh, I've just been following your post and I feel better already. That was great. That's the point.
I'm curious, moving from the civilian market where you started into the pilots, what differences did you notice in the neck and back issues that the pilots are dealing with versus maybe just a regular person on the street? And then to elaborate beyond that, you've treated helicopter and jet pilots. I'm wondering if you see differences between those two as well. Because when I'm flying the airplane, I'm like this. I'm flying the helicopter, I'm like looking down at my right foot or my left foot with a helmet on for an hour. And I know, I'm like, God, if I could just sit here and look straight ahead for a little bit longer, things would be different. So I was just curious to see what you noticed moving into those different fields.
thank you to our sponsor, Precision Aviation Group. Mission-critical operators and fleet managers rely on Precision Aviation Group as a worldwide leading rotor and fixed-wing MRO provider. PAG provides tip-to-tail solutions in 4 MRO segments: avionics, components, engines, and manufacturing DER services. A single point of contact gives you access to over 150 million in inventory globally, 24/7. Just call 800-537-2778. Precision Aviation Group. Others sell parts. We sell support.
Oh, great question, Bryan. A lot of both and answers to what you brought up. Your first question was differences between military pilots and civilian world. One, the injuries happen when they're younger. In the clinic, I would see the 40, 50, 60-year-old, and then military, it's the 20, 30, 40-year-old, so it's just, moved up so much quicker. And then the G's and the prolonged positioning of any pilot. So even if you're a 20-year-old and you're hanging your head down, looking at your left foot for a while, you're going to have pain after a few years. So it doesn't matter if you have degeneration or not. Hanging forward and looking straight down is 70 pounds of load off of your neck. So no wonder we hurt. And it doesn't even have to, it happens at a desk. That's a desk, not even tipped in a helicopter or in a jet. I think the both and response to that is what I saw in the civilian world was invaluable, helping me treat the military pilots, because there were so many similarities. Oh, you hurt here, try this. Oh yeah, that makes my pain go away. Right? So everything I bring to my military people, I've done that with my spine patients in the clinic. We're just doing it more or for specific reasons. I had a commander, and he had been flying adversary flights that day, and his right hand was on the stick in an F5, and he hurt kind of at the base of his right neck. Everyone kind of gets this pain at the first or second rib, and even the third rib on the right, if they've been holding onto the stick. And we kind of did a side plank on the left, elbow and knee, and did some other stuff. And he goes, I don't hurt. And that was, 15 minutes after that. So there's a bucket of research of after whiplash or acceleration injuries, the nerve to the muscle at the joint shuts off. Now that muscle has no power, and it will fill with fatty infiltrate. A researcher in Australia, Gwendolyn Jewell, and another gentleman, James Elliott, a lot of their research shows that. And so the idea is to turn the muscle back on by overflow and forcing it on after you feel the pain, but in a non-pain-free way, right? Pain will shut off the muscle, so you can't add more pain to the mix. So I think everything I learned in the civilian world and the clinic was really what made me stand out and what brought the flight line and I together to do something a little different. Going to your question of attack air or commercial kind of jet pilot versus rotary, the research shows a big difference, more neck and low back, and this one has neck and this one has low back. Honestly, I see it both. I started to walk into workshops and say, oh, you guys are rotary. You must have low back pain. And they're like, nope, we got neck pain too. And then I'd walk into, a squadron in Iwakuni and say, oh, you guys have neck pain. And they're like, we got low back pain too. So when you curve the spine and you load the spine, it's like playing whack-a-mole, like good luck, whatever shows up. So it's not necessarily one thing. Is there a tendency? Sure. The research shows 89% of pilots have neck and back pain. And a lot of times we'll have people say we want more data. It's not more data that we need. It's what are we going to do to address what we see in the data? And does what we choose, is that going to be effective? So people are a little skittish of doing programs. And then I think where it kind of goes sideways a little bit is when they put a warm body or a person with a degree in that position to then take care of it, and spine interventions get missed. And, a lot of moving parts, but I think the rotary and the TAC air pieces both are appreciative to have spine care help, and it's for pain. It's not just prevention. And you will never be strong enough to make the muscle on the back of your neck that's the size of a pinky handle 138 pounds at 7.5 Gs with a helmet and a face mask. And so to say we can prevent all that pain, that's not sitting with reality. It's not sitting in the real world or in the real aircraft seat. We need to know, if I'm looking down, I'm going to fatigue and I'm going to hurt, and I need something when I get out of the seat. And if I'm getting twisted, I need something when I get out of the seat. And when we can put both together, that's the win. That keeps the pilot in the seat.
Yeah, I think to what Bryan was talking about, when I was having to explain to physicians and everybody that I was involved with how the neck pain originated, they didn't really understand. We're like, oh, because we're in helicopters and we're flying. It doesn't really make sense to them until you show them what Bryan did, the position you're fixed in for a prolonged period of time. They see your hands are tied, your feet are tied to a particular position, and your neck and your upper torso is twisted so you can look out, in my case, the window to the left. And like, okay, that makes sense. He talks about a lot of the research that backs the physiology and like the injuries and how they take place for folks that are having to justify, their injury to whether it's workers' comp or the agency they work for. What studies are available that kind of outline, you talked about the forces that are in play with the neck. Like, where can people go to find information that kind of I want to say complete their claim, but justifies their complaint of pain?
Wow, that is a good question, and one of my current passions right now. And I post a lot of the studies on my LinkedIn page. I try to put up some resources of, one is a C5-6 and C6-7 is greater in fighter pilots than your average civilian cadre. So that's on LinkedIn. There's some other ones about the stretching, just, for you to choose a better avenue for physical therapy. But I'm glad you asked that, because it shows me that the need is there, because, some of my group, that's what I want to put on my website. There's going to be an open research page that we've created. So I just got to start linking them where, neck pain for rotary pilot, neck pain for TAC air. And some of those in the research that will show that whiplash, even one whiplash, shuts down the muscles. So now if I don't have muscles, of course I have degeneration in my neck. Well, we can't prove that's service related. Well, if the data is silent, I have an 06 friend, and he said, his name's Chop. And he said, if the data is silent to the right of the retirement ceremony, but then copious and obvious and screaming off the page to the left of the retirement ceremony, but it's not service related, that must be some amazing retirement ceremony. I mean, what are they doing? I want to be at that party. What were they, and it's the sarcasm is meant to highlight that, of course, it's service related. What else were they doing? The degeneration is there. The degeneration doesn't happen the week after or the week of. It takes years for that to happen. They were employed in the service for those years. That's where it happened. And that's where the model that I'm working on with another group and that research is important. And it's out there. If you needed it today, that's one of the things I help do is, Nexus letters or, okay, here, use these articles because that speaks to your issue. And we'll write it up really nicely and submit that. You can also search different keywords. So PubMed is a good one. Lumbar spine and rotary pilots, that'll pop quite a lot of stuff. So night vision goggles and rotary pilots, and then you go to the reference page of those articles and, there's 10 more and 10 more. And there'll probably be a title that you kind of go, aha, I found what I needed. Jet pilots, there's stuff from the Danish Air Force, Australian Air Force, that's all over the place. Some of it's survey-based. There is a lot of imaging out there, studies out there that has images of a fighter pilot or a jet pilot their spine looked like this compared to your control group. And so there can be your service link. And honestly, I think to stop putting Band-Aids on things and just say, it's service related. It is. I mean, if one whiplash can do that to a spine, you can also go to the whiplash research. If one whiplash can cause that injury at the neck or the lumbar spine, is there a way to mitigate the pain? Sure, that's where I come in. We don't need a surgery all the time. But did your neck undergo trauma from a force? Yes. So I would offer that to the listeners as maybe your starting place, and then we could get into more of that. But yeah, my website will be helpful for that shortly.
Okay. Yeah, that's super helpful because, I was in a position where I had to submit supporting evidence, as to how this is service related, like you had brought up. And there's not a lot of research that's specific to what I was looking for that I found. So the fact, and I know it exists, you talk about it, but I just didn't know where to find it. So the fact that you will have that available for people to utilize is huge.
Yeah. And, I'll be honest, my passion is to, I hate it when, in order to be politically correct, people lose out on help. It's well known that people go to a chiropractor for $150 out in town. You can always self-pay, and those are records, and you can keep those records, and they're time-stamped. And then you can always self-pay for x-rays and MRIs. They're expensive. X-rays are more like $50 to $150 usually. MRIs more expensive, but I would love to see a standard MRI and x-ray when you enter the service and then when you leave. And it's not, if you want to suck it up, you can, but you at least know there's going to be a comparison. And the hard part is with an injury, you may not have any findings on imaging that happen for years later, but then now it's the weak and wonky cervical ligament with the 12-pound head that looks down at a screen, pulling and loading a disc. And now we're off to the races. And so that's where it really can make a big difference to have some documentation. And, one gentleman I know that was successful, he had sought care for a pretty hard landing, like the blend code, like 903 and 904 both popped on an aircraft carrier. And he had probably 800 pages of documents that were from his chiropractor. And he just submitted all of that. And so for the listeners to kind of think of not outside care of I have to pay for it, but is paying for it now worth it? And a lot of times that stuff will go in your record, but I don't know. Think about it. You guys are the best judge of who you're with and what you're doing, but those are some things that I've seen happen. So
you kind of talked about some of the G loading that takes place and some of the forces that are at play when you're flying. Like Bryan said, a lot of times in our fixed position, we're wearing a helmet. The helmets have gotten, I think, pretty efficient with weight. I think a lot of helmets are 2 to 3 pounds now. You're seeing and you couple that with NVGs, and I think ASU's latest NVGs are, I think they're under 2 pounds. So you're looking at about 4 to 5 pounds of additional weight. And if you're orbiting a call in a helicopter at 60 to 80 knots in a bank, what kind of forces are at play with that? Can you kind of give us a general idea?
I'd like to say something sexy like, hundreds of pounds when at this angle. And that's kind of what the model is working on as well. The quick and dirty explanation, or the example I always use, is you put on the helmet and the mask, and now you fly at 7.5 Gs with TAC air, and a 12-pound head is now 138 pounds of load into the spine and off the spine. And so it's always exponential. It's always going to be determined by angles. It's physics, vectors, moment arms, lever arms, physics. And so if you're low, it's 2 principles. It could be a quick hard load, like, check 6 really quick and you pull a G and you're just there for, under a few, 15 seconds. It can be you guys in the helicopter with head weight of 70 pounds, add the helmet, add this stuff, night vision goggles. And now we're hitting maybe 80 to 90 pounds hanging off the head for prolonged periods of time. Think of a blood pressure cuff. What about blood flow in that area? What about blood flow to the tissues? What about blood flow to the joint in the neck? What about just compressive load? If I squeezed your wrist and shut off blood flow, that'd be a problem. My master's project was a pressor response to force. And the more pressure you have from the muscle pushing outwards or in on itself, you didn't have circulation. So, the blood flow restriction stuff that's coming out now makes, kind of like, yeah, but what about the nerve and some other stuff? So we'll see how that plays out. But you guys are in a hard position, whether you're going fast or hanging in a prolonged position with your head on your body for a long time. You're not crazy why that hurts. If I made you walk sideways on your ankle for a while, that would hurt too,
Especially some of the airspeeds we fly, we tend to have that low frequency vibration constantly in the helicopter.
Oh, yeah.
Even a smooth helicopter is going to have that constant vibration in there. And, from what I've heard over the years, you add that onto the discs and just general degrading of those soft membranes over time from just constant buzzing that's going on in there.
Oh, yeah, 100%, Bryan. They, Dore, helicopter pilot turned AMSO, one of my coaches, he would talk about how after vibration, you don't want a foam roll grinding on your back and neck and quads, it's already sore. In our world, if you apply vibration to a muscle for more than 2 minutes, it numbs it out. So if it's numb, what else is happening? And so it's not just the load and the forces, it's also neurological and tissue issues. And so you're 100% right on that. I don't like it. I feel sore when I'm under that kind of load and irritation to my body. So, and that's not even my day job. So I 100% agree with what you're saying.
So we've talked about the idea of the injury. Once you know that you're injured and you're dealing with the effects of neck and back pain, how can air crews start mitigating some of those effects of the pain? How can you I don't know if you can't stop the degeneration, but how do you help treat that pain?
Thank you to our sponsor, CNC Technologies. CNC Technologies, serving law enforcement, government, and military markets with tailored mission solutions, system training, and live 24/7 support with CNC.live platform. Explore more at cnctechnologies.com.
That's kind of debatable about the degeneration. So the degeneration I would offer happens because you don't have the stability of the joint. So the head weight no longer has a spine that has tensile strength of ligaments and muscles, or it's like you have a sprained ankle, but now in your neck or low back. So it's wonky. It's not as responsive. It doesn't pick up that the joint doesn't pick up that it's moving too far as rapidly as it used to, right? It's less responsive. If there's pain, the muscle isn't supporting or building tensegrity or almost like tent wires around a tent in a storm. You need to have some good stability. So if you put that back in the system, which is a lot of what I do, you don't see the degeneration as often, as fast, or as intensely. And you don't see the pain. Now, if that's not happening, or another realistic way to look at it is just a lot of events, right? 3,000 hours in the jet, 3,000 in the aircraft of any kind. I'm still in the aircraft, just all of those kind of situation. Yeah, there's your degeneration. But what we've seen with the TAC air groups and the rotary air groups is that if they get out of the aircraft and they do these things, turn the muscle back on, that's the whiplash research, where then the muscle now fires and is on. So fatty infiltrate doesn't come in. The muscle stays strong. The joint stays supported. But it has to happen after every flight, because every flight is this neurological whiplashy acceleration event. It's not going to kill you, but this is what we need to stop. And we're not, it can happen. We were doing it during popcorn time in the flight suits, so there are some ways to prevent the degeneration. What you want to do is you want to keep the neck and spine still. You'll see this in the Formula One YouTube videos of how they strengthen compared to other groups that are trying to sell devices where they want you bending and arching and flexing your neck. That's not what you do under load. You just had your spine under load. Keep your head on your neck and your neck on your body and keep it in neutral. Now have something try to turn you or do a lunge without poking your chin out, or, maybe you're getting, you don't have to buy a big device. Just put one of those resistant bands, 10 pounds around your neck or under your baseball cap, and then lean out to the right, lean out to the left. Forward is a little more irritating. I would lunge backwards. I probably wouldn't be doing the forward thing. That hurts me. That flares me a little bit. And a lot of this stuff I do is because I grew up with headaches and no one could really pinpoint what the deal was. And then I learned from Keith and NIOP some things that I can do that do decrease my pain. And so that's where this kind of comes from, my own experience too. If it didn't help my pain, I don't think it'll help someone else's pain.
Yeah.
It's kind of what I look at it as. Planks on your forearms where you push really strong through your scapula. That's a nice way to facilitate the deep neck muscles. You can always do an elbow plank. Side elbow planks with your neck in neutral seem to really get a nice overflow to the neck. Pull downs, don't start putting weight overhead. That's a load to the spine. Shoulder raises, I just pull up to level, or I keep my elbows bent and do pulses. I'm not doing lock out the arm stuff. I've stayed away from pull-ups because I've had enough injuries to my rib. Lateral falls can make your rib joints wonky, and then that's where you can get that flare up the next morning. So I pull the band and the weight's down to me if I want to work that muscle. I don't do the pull-up. I don't put the bar on my back. That's a hard load to the neck and spine. I don't do squats that way. The research is pretty clear that you can build your leg muscles equally with, the hex bar or dumbbells, or, put a belt around you and attach that to a machine and do belt squats versus the bar on your back. That's actually, we don't carry anything on our back like that. I know they do with rucking, and someone says, oh, well, in Africa, they put it on their back. And I'm like, yeah, but it's not 500 pounds either. Really matching what the body and spine prefers, and then mimicking that, and then just listening to what helps, how the spine wants to be treated, right? Platinum rule of the body. Treat it like it would want to be treated. Don't make up something on Instagram. So
yeah. For folks, Bryan, I see you have a question.
Yeah, I was just going to kind of follow on to that, and
please, yeah.
For everybody listening, what kind of things, for the people who don't already have identified that they know that they have a neck and back problem, the younger people who are newer into it, I think you fall back into this kind of workout. Is that a good pain or a bad pain thing? And you don't want to complain all the time, but you don't know what the bad pain is. What should they be looking for as an indication that they need to start seeking out some help, that they need to address this before it becomes a real problem? It's not, oh, you just, it's a tough job and you get sore once in a while and it's normal, versus that's not a good pain. That's an indication that you need to start dealing with it.
That's a great question.
John, before I asked him, I said, how did you know when your neck was messed up and he had issues with feeling in his fingertips and stuff? And I was like, crap, I had that too. Outside of calling one of us guys that have already taken it too far, what can they look for ahead of time?
I love that question. I don't know if I really, I need to do a post on that. That's a great question. Well, yeah, numbness in the fingers is not great. So the nerves for let's start with maybe the neck, and then we'll do a low back version as well. Pain that is work doesn't hurt the next morning, right? So I'm getting into this investigative place in my life where knowing what I know about the nerves and fascia and why do I hurt after a hard workout. I lifted heavy today. I didn't lift deeper than what my leg does functionally, right? Like if I'm going to be doing a squat in the garden, I'm also not meant to have hundreds of pounds on my shoulders, right? So that's a mobility thing I can do. If you go below knee level for the low back, you'll tip you get like this sacral knot and you're kind of jamming your L5 and S1. Just stay level, do the squat functionally. One example is I was able to do 3 flights of stairs 40 times during a move with heavy boxes. 25 pounds, I'd say at least 15 pounds or heavier every box, 40 times. I was not sore the next day. I was tired. And that's a difference of what work pain versus I hurt pain should feel like. So If you wake up and you have pain and you didn't do anything, that's something to think about. Well, what made me hurt so bad? Muscles are not on when you're resting. If you're hurting when you're lying in bed, that's usually joint, fascia, nerve, that telegraphing into your arm or neck. At rest, stuff shouldn't hurt. Now, you also have to think, can I get into a nice neutral position, or am I like hanging my head past the point that my muscle's helping me? Am I, in a really cramped position so my joint hurts? Use your reasoning with that. Pain into the arm, if anyone draws down their arm with their index finger to me, that I usually suspect nerve, and that comes out at the neck. And the nerves sit on the first rib, and then the collarbone comes over that and sandwiches them. Those get more compressed when we do that kind of forward head, aircraft, or desk position. And then now that telegraphs into the shoulder and arm. And then sometimes in the clinic, we would see bilateral, not just one side, but bilateral. So in our world, that's kind of like, oh, what's the neck or higher up doing? Bilateral carpal tunnel or elbow pain. Because you're not using both hands equally, it's something else is irritated. So something to think about is, how far down is the pain going? Is it at night? Is it at rest? Is it, and can I get into a neutral spot and it goes away? So there's like a strain or a load kind of quality to the pain. Nerves don't like loading. You unload them, feels better. It's like a hamstring stretch, right? That's a tension on the hamstring nerve. Or the S1 nerve. So same thing with stretching your arms. Pulling your arm back behind you to stretch the front of your shoulder will not give you anything functionally. Your arm doesn't need to be pulled more. What you're feeling is a tension of the nerves in the front of the shoulder, and they don't like that. There is nothing that pulling your heel to your butt in that quad stretch, like a runner stretch. We don't do anything with our knee like that. Our kneecap doesn't like it. That's not the way we go up a stair. It's not the way we squat. Doing more of that does not suddenly make my joints squat, run, go upstairs, or stand on my leg better. That pain is that nerve stretch response. And when we feel tightness, that quad tightness, it's going to be asking for glute strength or posterior chain strength or side abductors or derotational strength. That's going to be the unloader or the support. In the low back, pain telegraphing down the leg, it doesn't want to be stretched. There's some research that shows that if people stretch their calf, it wasn't just the calf that got weaker. All the muscles that the nerve in the back of the leg are the boss of, all of those got weaker because what you did is you stretched the nerve. And so now you go and you perform where you're trying to get your pain to go away. You're either weaker when you go to do an activity like running or command dodgeball or softball, right? Everybody, let's stretch. Or 40 minutes later, or like when you get home that night, the nerve's mad and now you go, I must have done a workout too hard. Well, did you? Or did you do a stretch? So what else you got, Bryan? Does that answer your question?
No, yeah, it's, you get done with a flight, you've been on a long flight and everybody's sitting around and hanging. They're like, oh, my neck hurts. Is it to the point where I should start calling somebody, or is it just,
no,
my
okay.
neck's sore from flying around? And what I'm hearing from you is maybe if the next morning I'm like, my neck still hurts, or when I lay down, my neck still hurts, then that
so
might
you beat
be...
me. You beat me to it. But I should have answered this sooner. So that is exactly when you would do the interventions that I teach in the workshop, and you would turn the muscles back on, like go to your planks, go to your pull downs, go to your over the ball press outs, turn the muscle back on. And that is when the pain goes away. So there's a difference between, that pain's achy. It's not debilitating. It's not that you blew a disc or there's something that's broken. It's the painful piece. So now you need to go and do the treatment to mitigate the pain. 2 things you get out of that. 1, you're not in pain. 2, 3 things. You didn't have to go to medical. And then you also stave off that degeneration cycle that you, John, were talking about, because now you're not limping and, this or that, or, shrugging your shoulders. You didn't not sleep well because of the pain. So for example, I had done a workshop at CVWP and we had the VAQ 132, the Scorps, Sting. They had done BFM flights, 3 aircrew, so 6, went out. I took time off, was waiting in the, because can't do contract work and do this, and so waiting in the ready room. I had each person come in. It was anonymous, so I just wanted to give them trust, preserve the trust. You were number 1 and you got page A and B, and you were number 2 and you got page A and B, and it was just, do you have neck pain? Yes. Do you have back pain? Yes. Do you, how would you rate it? Okay, great. And then they would hand me, I didn't even know their name, and they said, oh, I have neck pain. I said, okay, well, here's where you would do, this and this and this. And then they got up, and then the next person, I have back pain. Okay, well, you're going to do the over the ball this, and you're going to do this kind of plank and this, and they're still in their gear. Like they still had their helmets with them, and and the popcorn's popping, and we can't take a lot of time because we can't extend the debrief, right? And 5 out of 6 of them left the room with 0 out of 10 pain. We're talking pain, right? And so the 6th one said, it feels achy still, but it feels much better, right? Which is okay. He could go home and do more, and then that would relieve the pain. It is that simple. It's not rockets. It's just what we do with patients in the clinic. So I don't know.
Would you say that this is something that we should be doing on a routine basis, just after every flight?
I would,
as part of the debrief. Don't wait till it
Honestly,
starts hurting. Yeah. If it's some stretching and some,
no stretching,
activity,
right?
or I know the exercises.
100%.
Exercises.
Yes.
Yeah, I'll have a swear jar for that word here.
Yeah,
put $1 in it each time.
I'm going to start doing that in my workshops. I'm going to have a swear jar for stretching. I'm going to do that. I like that. 100%, because the whiplash research shows that with pain and acceleration, there's even an article on low back pain in, I think, fighter pilot. Don't quote me. I'm pretty sure there's an article on fighter pilots, low back pain. But what they're doing is they're correlating that painful side on imaging showed that the multifidi that go from bone to bone in the spine were atrophied at the location of pain on that same side. So when the muscle shuts off, we see it on MRI. We've seen it in the whiplash research. So we need to turn that back on in a non-pain-free way, not pull it. It's been pulled. It doesn't need more pulling, And so that's another way to look at prolonged, elongated stretching. If I had sprained my ankle, I don't go and stretch it. But why do we do that to the spine? If I had fallen on my wrist or I broke a bone, I don't think pulling it, I guess people would say traction does help. It does, but for a bone, but you don't want to pull it, right? You want to get it into a nice, comfy, neutral position. The stuff for the neck is, we will see most fighter pilots, the deep neck flexors, you're supposed to be able to hold them for about at least 24 to 32 seconds in the right way to expect to not have pain. Most pilots are 5 seconds when they're tested for the deep neck flexor stuff. Going to that, here's another don't do, but correct it kind of advice. Deep neck flexors are not make a double chin and pull as hard as you can and bend the spine and tuck up and use all the external muscles. The research shows that there's a sequence to them. You get the inside muscles on. Then if you have to lift heavier, you work the outside ones, but you do not keep tucking into a double chin, and you do not smush your head back on your neck and make more like neck wrinkles. You're actually bringing the skull back into the C2 dens, and that can create a ram's horn headache. So now I get pilots that are, well, they told me to make a double chin at physical therapy. That is not how it goes. It's keep the head and neck in neutral and then don't let it get moved. Then we challenge it. And then now we start seeing people feel better because they have the stability before they try mobility. So you wake up with that neck pain and I can't move my neck. Turning your head won't help more because the pain will always win, right? Like, does it hurt? Yep. Does it hurt? Yep. Still hurts. A day later, yep, still hurts. We need to get you in a non-painful position, over the ball, prone, hands and knees, planks, some of this kind of stuff. turn on the deep neck flexors and the deep neck extensors and some shoulder blade muscles. And then pretty quickly, oh, look at that. I can turn my neck now because you've supported the nerves. They're not feeling the tension of your head twisting. And you just don't have that pain. You're not limited by the nerve pain. Your body will win every time.
How about before
Were you saying before the flight real quick? Is that what you were going to say?
Yeah, I was just wondering, we're talking about these should probably just become a standard thing to look at after each flight. What about before the flight? Is there anything we can do to prepare?
Thanks to our sponsor, Anodyne Electronics Manufacturing, a leading manufacturer of trusted special mission avionics for law enforcement, aerial firefighting, and utility operators. Visit www.aem-corp.com and learn how AEM's digital communication and loudspeaker systems, avionics consoles, radios, and specialty audio products can support your most demanding missions.
Yeah. So again, not pulling, not stretching, no, bend the head, twist the arm, don't pull the arm across, none of that. But prepping and kind of that overflow to the muscles you're going to use, like hands and knees, planks, 5 groups, 20 or 30 seconds, elbows, knees, squeeze your glutes, side planks, pull downs, like prime the pump a little bit. But we're talking 2 or 3 minutes before you put your gear on, even down in the gear room. Right? It doesn't have to be a huge workout. And then you come back and now the muscle's turned off because it's tired. Do the overflow again.
Okay.
Right. So it's a treatment and a primer. Yeah. Great question.
That's huge advice. And I thank you for sharing that with folks. But I want to encourage the TFOs in this because I think they're probably hearing us talk about the pilot role, but you think about the ergonomics involved with being a TFO. You talk about your head being in a neutral position. That's not where your head is in either seat. As a TFO, oftentimes if you're looking at the monitor, you're lean forward, your head's off center. You talk about your head hanging. You're kind of staring forward. Or if you're out the window, you're again not in neutral position. Your head's hanging down to your left, and so this is where I think the TFOs need to be doing what you're describing. This isn't just for the pilots. This is for everybody.
Oh yeah, if I could fly a banner behind a plane, that would probably be the one. It's for air crew. And, and honestly, it was for maintainers too. It was interesting because at first I heard, when I was at Whidbey, I heard pilots this. And then what really stood out to me was the backseaters, like the EOs and the navigators and then the maintainers and then search and rescue. Oh, I'm an air crew and I'm sitting on a rope bag, but I'm too tall. And then the backseaters in the growler were saying, at least the pilot knows when the G's are coming and he can brace his head. I'm down there looking at something and I'm looking at this or I'm twisted and he flips G, into any kind of heavy G and my neck just buckles. And they are 100% right because there's something called a following load where the bones are supposed to be stacked. And again, it's to protect the spinal cord. It's not meant to be twisted looking around. It can, but it's not its happy place, right? And now you load for a prolonged time, like looking at your left foot, or you do it quickly under G's in a whiplash fashion. And one, you're doing so out of its follower load, out of the stacked neutral position of the bones. The bones stack on each other and quadruple their force endurance or their ability to withstand force. When you come out of that, they lose each other's help. And that's where you guys are getting hurt a lot. And so when we did this, again, I go back to the Scorp, the Scorp BFM flight, and it was aircrew too, right? It was the backseater who had the neck pain and the back pain. And you're like, oh yeah, this feels so much better. And then, rotary wing, it's both sides. And then even the aircrew in the back, like search and rescue. Oh my word. I think that's where I just watch how they have to be on their knees, sit tucked, they're loaded, NVGs, twisting, moving. It's exhausting. And then you can't even if you have good leg strength, you can't use it because you're on your knees. And so it's just all the different human factor pieces where you're not broken. It's bent. You're just bent a little bit. It would be nice to get to a normal cultural status quo where this is taught in the schools and this is kind of the thing that we just change culturally. And this is how you take care of your spine. and you're going to hurt and it's okay, but here's what you do. You don't have to guess. You don't have to pull, but do these things. And we'll probably handle it about, I'd say 89% of the time.
When I hear people talk about the Navy and the medical program, I'm always very impressed on how organized it is and how much money is put into it. And I know probably people in the Navy think it's maybe not enough, but coming from law enforcement where there's nothing like that. We have no support. We have no backing. It's just a scattering of hundreds of different air units with, there's standards for the industry, but even within those standards, it's very different how it's run. And in this place, it's a sergeant. This place, it's a chief pilot. In this place, there's nobody. This place, they might have somebody, medical within the agency that can help. This place, you just use your insurance. And there's really there's no hope. There's no standard to rely on. So people could start calling and say, hey, what do I do to deal with this? What kind of helmet should we buy? What kind of medical intervention should we have? They don't even know who to call and ask that. So I'm thinking as I'm listening to this, and I know a lot of our listeners are wondering the same thing. If they're in a position of any kind of leadership or supervision within their organization, usually that's it. If their people are going to get help, it's that line level supervisor that has to try and convince a non-aviation organization that, and frankly, law enforcement really doesn't do that good of a job taking care of their people physically or emotionally. They're trying in some places, but in general, there's not enough money or time or understanding there to do it. So some line level supervisor thinks, I want to take care of my people. I have no idea. They've been writing down notes, listening to you talk. They're looking at the links that you're telling them, send them to. What do we tell that supervisor saying, I don't want my young pilots to come to me in 10 years or in 15 years and say, I wish you would have done something more for me, or I wish we could have done something so I'm not hurting like this. I don't want to have 3 guys out on FMLA because their neck's killing them, or try to be filling in pilot slots. So what can we tell that person? Although we've already said a lot, but what can we tell that supervisor? What can they do to go and try and help take care of their people a little bit so they don't have this problem?
Oh, I love that, Bryan. Yeah, and that's the goal, right? To create a culture of mental fitness that is taken care of, as well as the physical fitness, but knowing that pain and rest and mitigation are part of that protocol, not just work out. Now you're hurt. Now there's nothing. Great question. So my first thoughts would be, that's what I do. I do the workshops and I go and I train, and that's, they can always reach out if they think that's a good idea. A few different places have brought in certified strength and conditioning coaches. That's a great idea. I feel like many, your generic fire department, they can look up how to work out. And so I don't know that that's kind of what they're looking for. They're looking for, when I hurt, I'm going to be debilitated, I can't do my job, what do I do? So something to think about would be not just ergonomics, because you can only stay in neutral for so long. Life doesn't happen in neutral. So you see that in the research. So I don't know that ergonomics would be the way to go. Some resources that would mimic what I do would be so real basic. Hey, everybody, you want to be doing some strengthening and some stability with your spine in neutral. That looks like Pilates. There's a group called Les Mills On Demand from Australia. They follow the American College of Sports Medicine guidelines. It's what most of the gyms buy their classes from, but they have a good core, CORE class on there. You can kind of learn what that should feel like. That's what I would suggest. Instead of doing burpees, maybe you're doing different things with bands that you learn from there. There's another group that I liked, Functional Patterns. That line boss could even take that course. I think it's like $300, but they're very good about, it's not the stretching and the bending that changes the back pain and the neck. It's what you do with your workouts and your keeping your spine in neutral while something tries to turn it. So that is another good group. I've referred people to that often, and it's just a nice kind of concept. Great Facebook group to follow. They always get the yoga person that's like, well, yoga's not that bad. And they're like, well, we get a lot of people that have been injured, so we're going to stick with what we're doing. They're just really funny about it. Like it's time to change the paradigm. If stretching were going to do it, it would have done it. We used to say if walking with a walker was going to make you strong, it would have done it. It's not, we need something different in the system. Gosh, that's a great question. It's hard because it depends on resources available. It's hard because you don't want to go to bat and say, hey, I want $100,000 to have a workout and a coach and some people that really know their stuff about spine. And so what's the middle ground? What's, 3 levels down from that? Do you have somebody come by and do a training? Do you have somebody? Yeah, that's just a great question. And that's really where that's where the rubber meets the road and why we still have a problem with not just military resources and what they can do when they don't have a big program. But you're right, anybody, law enforcement, and isn't it amazing that most of law enforcement and fire and EMT, usually they served in the military at some point, right? Airline industry, any of you guys, the neck that has been in the military or has been in some kind of law enforcement, it follows you. And it's interesting to me that we haven't brought help that helps to the academies and that culture change yet. But we're getting there. So.
No, I think that's hugely important. And what Bryan's talking about, it's 100% true. As an employee, the first problem you have is convincing your department that the pain you have is a result of the work you've done.
Oh,
and then you've got to justify going to get the help you need through the appropriate channels like yourself. So I think the justifications is often difficult to do when you're talking to somebody who doesn't understand the language and doesn't understand the mechanics of what we're discussing. So I love that you've created this company, and my hope is that for someone who's in this position and trying to justify their ability to get treatment, hopefully from your company, they can reach out and maybe you have some information that you can share with them that will help get those approvals in place so they can come get help from you and the services you offer. Because it is, again, our industry, just about everybody's affected by this. There's no doubt about that. So there's a huge need for this treatment, for the mitigations to be put in place to prevent debilitating injuries, so it's just a hugely important topic. And
thank you, John.
Yeah, I appreciate you taking the time to go through all this with us. My head hurts, I'll admit.
Well, and I think too, looking around locally, there are good people that know spine. You can kind of interview them and kind of listen, you'll know they speak the spine language as soon as you meet them once or twice. If it's just a lot of, well, this is what we want, and they kind of, explain their way out of it. They need to get right to the meat of it pretty quick. And then if you find that person, then that's a person that can, then you start referring, it's that word of mouth and who's pretty good. And, is someone learning and curious and, look for the helpers, right? That's what we always say, look for the helpers. And it's funny you bring up, I helped a search and rescue helicopter group before I started with the Navy. I helped them raise funds, and search and rescue was interesting because I saw that they didn't have a language for mental fitness or resiliency, or, they didn't have our medical language of like, oh, that's a trauma, I need to do this for it. And my back hurts. And they didn't know any of that. And they were one of my first groups where I went and offered just advice for the day at one of their training days. And they were like, wow, no one ever told me that before. And so, to think back, it's, kind of started there in some ways,
Before we close out, Bryan, do you have any last thoughts or questions?
I do want to ask, I saw on your sheet here, there's something about the Blue Angels, and I did want to ask her about that. And topped on with that, you got to be honest, you spent this much time working with the Navy and Marines. At some point, they have to have given you a nickname of some sort.
Yeah, well, so the pole designation, it's fishing pole, and then, now it's becoming pole position, but it's, from Feed America, the CEO, when she speaks, she, talks about how There's this saying of teach a man, give a man a fish, he eats for a day, teach a man to fish, he eats for a lifetime. She's like, most men and women know how to fish. They don't have the fishing pole to do it. And so our TAC Air pilot, Gazer, he's like, that's it. You give us the tool to do what we can do. We just don't know how, we needed the equipment. We needed the guidance. We need, and that's so true. They need just a little nudge and then they can run with it. Any of you guys, you get yaw, pitch, and roll. So I say yaw, pitch, and roll of the body and you run with it. Then at Whidbey, I start getting spine Yoda and back dock, and those have been pretty fun, So the whole spine Yoda thing, I'm like, yeah, let's do that.
Yeah. Latch onto a good one because usually they're horrible.
I know.
So you find one that you can say on a podcast, you keep that, hold it with both hands.
Right. Yes. I did not balk at pole. I was like, well, and then the Blue Angels, that was just, that's a big circle of trust, right? So I just, keep their trust and talk about a precision athlete. Oh my word, to just their mind and their focus and 3 flights a day for weeks to be able to train and do the knife edge pass. And they've been the pilot that I've been coaching over here. And then now I didn't get them before the Blue Angels, but now they're in the ready room of this other squadron. So that was fantastic because top down, they support each other in a way I've never seen, it's one of the most supportive, incredible environments. And, there's no, there is competition of the self wants to be better, but they are all so focused in their role that they are not competing against each other. And it's the pilots bring up the maintainers support. It is this 3-dimensional support of atmosphere of support. And they are just, if you ever get to meet one, you're going to be blessed. They're just lovely. What was interesting is, they have a 30-pound stick that they have to hold on for the aerodynamics, and their elbow can get pretty sore. And I had a conversation with them previously, a few years ago with a different team, and they were going to start doing some stretching. And even then I was like, oh no, and they don't have a lot of time. Their bandwidth is taken up and they need something that works and works quick. And so when I was able to work with them, my elbow hurts. Okay, try this. Oh my gosh, my elbow doesn't hurt. And my neck's been killing me for a few days, as it should. If anything's going to hurt a neck, you would think that would do it. And sure enough, it does. And I took them through some stuff. And, the female pilot, Amanda, Lieutenant Commander Lee, just fantastic. She's like, oh, this feels so good on my neck, and so it was just an honor and a privilege. And this stuff works whether you're on a BFM, Top Gun, Blue Angel kind of flight. It works if you have been out 10 years and your neck's been beat up and you've had 6 surgeries and you've been looking at the screen all day at your desk and you just need some pain relief. It worked on the Electronic Attack Squadron commander who's been instructing for 20 years, and it works on the, newbie who's been out 3 or 4 years. And it's just, when you speak the spine language, it speaks back and it appreciates it and it responds. And might be going to a few different other impressive places to see if we can help them out soon. So keep you posted.
So cool. You've literally worked with the top aviation athletes,
the best of the best,
as you brought them up. Yeah, the best of the best in the world.
Yeah, they really are the best of the best in the world. It was really an honor to have them let me in their circle of trust. That was wonderful.
I was just going to mention that you brought up trust, and that's a huge, huge deal, especially in the military and especially in the Blue Angels. So the fact that you've earned their trust, is evidence of your ability to help mitigate and treat this pain. So thank you again, for all the work you're putting into our industry and for helping us, let's say, get rid of the pain. Hopefully that happens, but mitigate it.
Well, be the boss of your pain instead of the pain bossing you. If that can happen, we win, right? I had one pilot say, I don't know. He was deployed. He was a VAQ 135 guy, and he said, I don't always hurt, but when I hurt, I do these and my pain goes away. It's a win, right? That's all we need. So
that's awesome.
Yeah.
Well, thank you again. And I'm sure you're going to have plenty of folks reaching out from our industry.
Thank you so much. You guys are so great.
And until we meet again, we'll catch you later.
Yeah. Hopefully I'll see you. Are you going to be in California, May 12th through the 16th, John?
I will be actually on the East Coast. Unfortunately, yeah.
I'll be there. I'll be there for the Naval Helicopter Association.
Bummer.
Yeah. So.
Well, we're gonna have to figure out a way to meet up at some point. We need to get you to AppsCon. Is what we need to do.
Let's do it. Let's do it.
Into Bryan's safety sessions.
That's a great idea. Let's do it.
Yeah, you'd have them lined up around the door. We'll just have
that's my plan.
Neck and back pain lying up here, and then we go,
yeah, right.
You have 1,000 people
standing. Right?
What's in here? I don't know. It's something about neck and back, so I lined up.
I'm just doing what I'm told. You know, yeah. No.
All right. Well, until then, we'll catch you later.
All right. Thank you.
Thank you for everything.
This is the end of our conversation with Dr. Ryan. Stand by for a message after a word from our sponsors.
Thank you to our sponsor, CNC Technologies. CNC Technologies, serving law enforcement, government, and military markets with tailored mission solutions, system training, and live 24/7 support with CNC.live platform. Explore more at cnctechnologies.com. Thank you to our sponsor, Precision Aviation Group. Mission-critical operators and fleet managers rely on Precision Aviation Group as a worldwide leading rotor and fixed-wing MRO provider. PAG provides tip-to-tail solutions in 4 MRO segments: avionics, components, engines, and manufacturing DER services. A single point of contact gives you access to over 150 million in inventory globally, 24/7. Just call 800-537-2778. Precision Aviation Group. Others sell parts. We sell support. Thanks to our sponsor, Anodyne Electronics Manufacturing, a leading manufacturer of trusted special mission avionics for law enforcement, aerial firefighting, and utility operators. Visit www.aem-corp.com and learn how AEM's digital communication and loudspeaker systems, avionics consoles, radios, and specialty audio products can support your most demanding missions.
Thank you for supporting the sponsors who make important conversations like these possible. I'm thankful for the wisdom and advice of Dr. Ryan. I wish I'd known about her practice long ago. I briefly mentioned this in the podcast, but I've undergone 2 neck surgeries that ultimately ended up ending my career prematurely. I was fortunate to have Dr. Robert Watkins IV, who's the director of the Marina Spine Center and past chief of staff of Cedars-Sinai Marina Del Rey, and current spine surgeon for the LA Dodgers, Rams, Lakers, Clippers, and Kings. If you end up needing spinal surgery, find someone like Dr. Robert Watkins. Many workplace medical centers will just refer you to their nearest spinal center for treatment and spinal surgery. I learned the hard way you have to be your own advocate and fight for the best treatment possible. If you're in a position where spinal surgery is required, I highly recommend you reach out to Dr. Robert Watkins at the Marina Spine Center, which is located in Los Angeles' seaside community of Marina Del Rey, just up the way from LAX. This isn't a paid advertisement, just personal advice. Cheers.
Time to close up the hangar. Thanks for joining us on the Hangar Z podcast, brought to you by Vertical Helicasts.